When we talk about high blood pressure, we usually focus on the heart, but the real story is often happening in the miles of tiny blood vessels throughout your body. If you're taking amlodipine, one of the most common prescriptions I write here in Singapore, you're not just taking a generic pressure pill. You are using a tool that's specifically targeting the tension switch inside your blood vessel walls and allows them to finally relax. Before 1960s, we didn't fully understand why blood vessels stay tight. Then a scientist named Albrecht Fleckenstein discovered something fascinating. He realized that calcium, the same minerals that strengthens your bones, is also the on switch for muscle contraction. He found that when calcium enters the smooth muscle cells of your arteries, it tells them to squeeze shut. If that on switch stays on for too long, your blood pressure stays high. Fleckenstein's work gave us a way to gently block that signal and allows the vessels to let go of that constant squeeze. Amlodipine belongs to a class we call calcium channel blockers. It doesn't touch the calcium in your bones. It specifically targets the tiny gates in your blood vessel walls. Now, by slowing down the flow of calcium through these gates, the medication allows your arteries to stay in a more relaxed, open state. And when the path is opened, your heart doesn't have to push nearly as hard to move blood through your system. It's effective, it's reliable, and for many of my Asian patients, it's a particularly powerful way to lower blood pressure without affecting heart rate. Because we are opening up those vessels so effectively, well, you might notice some noise in the system. The most common thing my patients tell me is that their ankles look puffy by the end of the day, or their face feel a bit flushed. I want to reassure you that this isn't a sign that your kidneys are failing. In our Singapore heat, it's often just gravity because the small vessels are so relaxed. Fluids sometimes settle around the ankles. It can be annoying, but it's actually a sign that the medicine is doing exactly what we are asking it to do. Remove that resistance in your pipes. Now, I recognize that many of us are tight in our lives and tight in our arteries, so we use these medications to give at least our cardiovascular system some room to breathe. I'm Dr. Peter. Let's find the right harmony for your heart together. If you are noticing that ankle swelling, don't just stop the pill. Let's talk about adjusting the dose or adding a counterbalance. Are your heart medications give you side effects? Well, let's troubleshoot each of them together in the comments.